If you're interested in Dr. Freddy Starr's Neurofeedback Training and would like to either do one of his vacation packages or to use the Home Brain Training Kit, I have a coupon code for 15% off, and the code is Biohacker. You can use that when you contact him on the telephone number or on the email, which I'll provide in the show notes. Hello, everyone, and welcome to Biohackers Lab. I'm your host, Gary Kerwin, and on today's episode, I have Dr. Freddy Starr. Dr. Starr has been in the field of BCI, or brain-computer interface, since the early 1990s, and he obtained his medical degree in 1999 and is a trained psychiatrist. He opened his first practice utilizing brain scanning and neurofeedback back in 2003, and has since that time continued his use of neurofeedback and brain scanning in the field of neurofeedback training. Dr. Starr, thank you so much for coming on to the episode today.
Thanks for having me.
So I butchered your introduction there a little bit. You've done way more than that. If you wouldn't mind just explaining, you've been in the field of brain scanning and neurofeedback even before you obtained your medical degree, isn't that true?
Well, when I was an undergrad, I was just happened to have the opportunity to work in a lab that was doing seizure research and using computers. It was the size of a refrigerator, and we would wheel it around on wheels to analyze maybe a couple channels of brain data. But back then we were doing it, yeah.
Okay. And so I guess you're my first neurofeedback brain specialist that I've had on the show. So I'm going to just have you, if you wouldn't mind, introduce people to what is neurofeedback training.
Well, neurofeedback training is like exercise for the brain, to put it most simply. We're able to use a computer that's like the machine that you would use gym, and instead of your muscles training, you're training your brain. So you can hook your brain up to the computer, and because your brain speaks in a digital language, the computer can actually decode it and understand it and give you feedback to help you learn to retrain your brain waves to work in a more efficient pattern.
Mm-hmm. So I guess this is what people are always trying to do when they meditate. They're trying to alter their states, their brain states, and you're just quantifying it and helping them find better states.
So the meditation has been one of the areas that I've focused heavily on as far as, in the last, say, decade and a half in brain scanning and neurofeedback. There are different ways to meditate, and there's actually, to me, I see it as different physical positions you put your brain in when you meditate. So, just under the rubric of that, it's a little different than meditation because I don't know what your brain is doing when you close your eyes and meditate. This would actually help your brain reach a state of meditation or, that kind of balanced, equanimous state easier and faster, especially if there's some kind of damage like a head injury.
Okay. And so what you're looking at are different brain waves, because I guess maybe a lot of people might have heard of alpha or beta. Yeah. That's what you're looking at when you're looking at someone's brain, is it?
So they're called frequencies. These are different brain waves that span like a frequency. A frequency is a speed of a brain wave, or a speed of any wave. And the slowest waves that we look at with the brain are called delta waves. I like to call it dreamy delta waves because when people are sleeping, they make a lot of delta waves. So if a person has too many delta waves in the frontal lobe of their brain, they're going to feel dreamy. So they're like delta dreamers. The next brainwave that is grouped is called Theta or Theta. And when you have, say, too much Theta, you tend to be maybe more inattentive, have difficulty getting things done. You may have some lassitude, and just really be a couch potato. So I, think it's easy to remember theta, couch potato. Alpha is brainwave of consciousness. It is the predominant brainwave when your eyes are open, and it occupies about 8 to 12 hertz. People who have problems with alpha can be very spacey. They might switch from different topics. They might have trouble focusing or concentrating. So alpha is kind of like moon unit alpha, kind of like people are out in space a little bit. Is how I remember that one. Alpha is also associated with mood, so it's pretty common if you see alpha where it's imbalanced, you can see depression, and that's fairly clear to see on the EEG, the QEEG, which I can get to in a moment. And the beta waves are the faster waves, and when people have too many beta waves, they're like buzzing in their head. They're anxious, nervous. They can be irritable or angry, so they're beta buzzers or buzzing beta. So it's a way that I can remember these brainwaves that go from slow to fast.
Okay, yeah, that'll be great, because I think that as a consumer, that's probably typically what we get told, the brainwave activities. And I know you look at things in a lot more detail. So when you mentioned there QEEG, is there a sort of a difference then in the neurofeedback training world?
Yes. So EEG stands for electroencephalogram. That electroencephalogram has been in use to study the brain since 1930s, when it was actually first invented to try to look at extrasensory perception and mental telepathy. Since then, people have applied various, mathematical techniques to the EEG. Looking at it from a statistical standpoint, it's called, you put the Q there. You call it quantitative EEG. And all that is taking the EEG and looking at the different frequencies and how much voltage or how much electricity they're making at any given area. So you can tell if an area is either overworking or underworking when you look at a QEEG, and it shows you colors of if the activity is too high or too low or too fast or too slow. It can show you if there's abnormal connections between areas, so if the brain is not communicating with its other parts as well. And you can turn it into 3 dimensions and be able to tell where exactly within a couple millimeters of a brain area where the problem is. And you can pinpoint that with neurofeedback training. Now, additionally, with the QEEG, you can start to apply some machine learning techniques and actually make quite a few deductions for prognosis, what somebody's outcome might be, maybe what disease states they might go on to have. So we're actually doing a lot more with the QEEG now than even 5 years ago.
Okay, so it sounds like you're even using the QEEG not just for a diagnostic point of view to see live, you're actually trying to use it as a predictive model to say, okay, your pattern that we're picking up here is saying that you might end up in as a particular mental state. Is that what I?
Yeah, exactly. So in my case, I developed and patented a machine learning EEG program, and based on my practice now, I've amassed something like 20,000 scans with associated data that I load into the program, and the program's called Anna, Advanced Neural Network Analysis. So if I refer to Anna or her, that's what I'm referring to. So she's now fairly good at picking out Alzheimer's potentially in the future. Based on literature, there's quite a bit of literature out there, so you can start to see that in the brain. Recently, she had the diagnosis of Lou Gehrig's ALS that I missed on the scan, and the doctors also didn't get. And we also had somebody with a left frontal tumor she recommended MRI.
Wow. Okay. That is awesome, because one of my previous guests, Amy Berger, she was talking about Alzheimer's, and in that we were mentioning how hard it can be to pick up a neurodegenerative disease until it's quite far advanced, and that some people are having to do PET scans, or to me, this is even sounding like functional MRI, where you're trying to light up different parts of the brain and then get a clinical picture out of it. And that sounds really cool, that you can put these electrodes on and then plug it into your algorithm, and it's already giving you some sort of clinical direction as well, which way to go. And so that's what you refer to when you're talking about brain scanning is your QEEG sensoring.
Well, that's what I am speaking of. But you've mentioned a number of other different kinds of scans, and if you don't, I would touch on them if you want me to.
Yeah, sure.
PET scan is positron emission tomography, and that's looking at metabolic rate of the cells. So we're working on the order of chemical reactions. So it's a little bit slower with regards to discrimination and seeing things in real time. SPECT scan, which is what many people know is done by the Amen group, is invasive. So you have to use a radioactive label. You have to actually put something in the body, and it doesn't necessarily give you any idea for outcome other than supplementation, and they're pretty costly. A QEEG is looking at the brain on the order of milliseconds, and there are textbooks the size of phone books that go through QEEG matching with fMRI, matching with PET. This has been determined in federal court in the United States, and numerous other courts have upheld QEEG as being comparable. So you get a pretty good picture. But the thing about QEEG is we charge $100 a scan. I mean, it's very inexpensive. It's easy in that all you do maybe is get messy hair with gel. It doesn't hurt. You're not putting any quantity of energy in the body, so it's not modifying anything. And so, the other ones have their place and their validity, but so does QEEG. So when I'm talking about a brain scan, that's usually what I'm referring to as QEEG.
Yeah. Okay. And so for me, I have an interest in neurofeedback because I've been to some of the biohacking conferences, and they have devices there people are taking all kinds of supplements and things to change their brain waves, because that's what biohackers are all about, is trying to get optimal brain function, optimal physical function. But brain really interests me, and that's why I actually got into the biohacking world. And so I'm interested then with the neurofeedback training that consumers might think of at the moment. So I can think of devices like the Muse that you put on your head and you listen to sounds and you try control the sounds. That's a form of neurofeedback training, is it?
It is the principle of neurofeedback training.
Okay.
I have a bunch of Muses. I call them a toy. I don't believe that they have. I think that often in an amateur's hands, you're not getting clear signal. It's very difficult to eliminate artifacts. So movements, eye blinks, everything affects them so much. They don't have great filtering or shielding. So even me in my office has a shielding, and I check for electromagnetic frequencies that could be coming and everything, I still have trouble getting real clear, good signal with the Muse. So I think that the principles there, I'm glad they're out there getting into public perception, but honestly, I think that maybe people are better off saving their money.
Okay. And then that's where what you're doing now clinically just takes it to a whole new level. If you wouldn't mind just explaining then to someone who is interested in the world of neurofeedback or has already started going down that route and they've got some of these devices. So how does your system work then that you do to help alter the brain? What would it be like for a patient or a client coming to you?
So for me, well, when you say coming to me, I'm not in the really position where I'm putting caps on people or seeing them individually now. So I have a company that services physicians' offices around the world.
Okay.
We're in Hong Kong, the UK, US, and they are the ones getting the scans. So you would go into the doctor's office, and right now in the US, they're requiring, at least in 7 different practices that we work with, that everybody over the age of 40 should have a baseline brain scan. So they're coming in, they're having their workup, and if it's warranted, they're then going for the EEG, where they just put a cap on their head. It's like a shower cap, and their gel gets squirted into each sensors, and then we record the brain waves for 3 minutes in the eyes closed, 3 minutes with your eyes open, and then that gets sent to us where we analyze it and then produce reports.
Okay. And who are the kind of people that can benefit then from neurofeedback? You don't have to have a diagnosed sort of mental diagnosis condition. Even if you're just wanting to get more out of your system or manage your stress levels better, you could still benefit from neurofeedback training.
Yes. The mental disorders have come about through observation. They're phenotypic. They're things that we see in people's behavior that really come out of statistics of monitoring people and deciding what's normal and what's not normal. And I mean, we could have an in-depth discussion about some of the original assumptions of that research that actually comes out of the UK. Katie Lang was the pioneer of that. But the QEEG in neuroscience now the brain doesn't say it's depressed. I mean, it doesn't. You feel depressed, but and there's some signature in the brain that might be associated with mood problems, but there's no depression area, so it's hard to mix the two. So when I'm thinking about people doing neurofeedback, everybody's doing performance training. So yes, no matter where you are in life, I mean, when people ask me, who do you think is the best candidate for this? I'm like, people with a brain. For me, the conditions that we see a great deal of, or that I find that what we do lends itself best to, is peak performance training to improve attention, to improve reaction time, to say decrease stage fright. We've worked with many actors in that area. Also sleep and mood and attention and memory. So wherever you are on the spectrum, yes, you can improve that. I've even seen people now kind of going even further than what one would assume would be, within normal limits, and say increasing an area beyond what would be normal, but it renders a beneficial trait. So, and you have biohackers. I can be specific. I'm talking about increasing posterior alpha. I'm talking about raising 12 hertz, 12 to 15 hertz at C3 or C4, decreasing intrahemispheric coherence posterior, something like that.
And you'd pick all of that up that in your initial brain scan that you'd want to alter certain places.
Yes.
So that also gets me thinking then. That's why you would need someone with a bit more clinical knowledge when it comes to this, because you are able to manipulate the brain then. And if you can manipulate it in a positive direction, do you believe you could manipulate it in a negative direction too, and get a unwanted outcome?
I've seen it happen.
So
I see oftentimes people will come to me after, say, having a failure somewhere, or send me a brain scan and say, what do you think of this, or whatever. And I'm not surprised anymore, but you see a lot of stuff out there that clinicians aren't necessarily properly trained.
Okay. Because I heard with a bit of the history behind neurofeedback training, what was fascinating was that the technology was first used to control seizures, was it?
Yeah.
So that's
actually, yeah. In the late 1950s, NASA was working, I think it was on the Mercury space program, and they were noticing that some of the workers were having seizures around the rocket fuel vapor fumes. Some were not. And so by studying the differences in the people's brains, they noticed that the workers that had naturally high levels of a brain frequency called SMR, sensory motor rhythm, which is 12 to 15 hertz across the sensory motor strip between the ears, people who have higher levels of that tend to be able to ward off seizures. And so they gave a grant to a doctor by the name of Dr. Barry Sturman in California, who applied the technique to cats, who applied the work of B.F. Skinner, Operant Conditioning, to cats to see if he could train them to increase their SMR, sensory motor rhythm, in their brain. And he found that he could train these cats to increase their SMR, and they had less seizures. So they then applied the technique to the workers, and they found, lo and behold, the workers were able to work with massive amounts of rocket fuel vapors around them. And also it proves that you can train a cat. then that work went on to be used with some very severe epilepsy cases, and the literature is pretty remarkable over decades and decades and decades. A lot of papers. Yes, neurofeedback is a useful application for epilepsy and seizures.
And because I've had a guest on before, Emma Williams from the UK with Matthew's friends, and that was talking about using the ketogenic diet to help manage epileptic symptoms. With neurofeedback training, is it? Do you know if it's been actively used to help epileptic patients too?
Neurofeedback?
Yeah.
Oh, actively, absolutely. I am not advertising myself as an expert in epilepsy and neurofeedback. I don't, it's one of the ones that, to me, it's a little bit close to home and it's difficult to treat. But I know many experts who really have incredible results with tragic cases. I mean, it's a terrible disease, and especially when you can't control it with medication. So the fact that this can, and you really do see quite a reduction in seizure frequency and generalization of epilepsy, it seems to me it doesn't make sense why it wouldn't be used kind of first line, at least along with meds. Yeah, I
can see sort of like a positive cumulative effect. So you could, from a dietary perspective, you're feeding the brain and the neurology in one sense, but then you're using this technology, and hopefully it all comes up, just adds upon each other to help you control.
Well, that's the first thing. I've recommended ketogenic diet twice this week to 2 individuals who contacted me with seizures. High dose fish oil, magnesium, hardcore ketogenic diet, neurofeedback, even CBD, cannabis oil, all can help.
Yeah, because before we came on the show, you were telling me that you're doing some research at the moment, aren't you, with that?
Yes, I'm doing a project with a group that does marijuana for trauma in veterans, so individuals that have post-traumatic stress disorder, and they are a day clinic where they have art therapy, and they have come in and they have group therapy, and they also are given medical marijuana as part of their program. So it's a pretty structured program. And what we're doing is studying the brain effects of it, quantifying that. So seeing what types of different strains and different concentrations will have the effect on an individual's brain, so we can tailor the when they come in, they can get a brain scan, and the machine can say you would best be suited for XYZ type of marijuana rather than another kind, and maybe we can lessen some of the negative responses, and also weed out some of the people that aren't good candidates, and there are some.
Mm-hmm. And again, I just love that idea that you're able to sort of use a predictive test that is sort of non-harming, as you said, because you're not getting ionized, you're not getting exposed to X-rays and having to take anything that can damage you, but you're already sort of pre-predicting, look, you take this chemical, you might not get the response as you expected, so just be aware of that. And I love that idea that you can use your neurofeedback training to be able to, or the QEEG to be able to do that. I love that. If you're doing that with medical marijuana, have you found when people think about taking brain supplements that might be another way because nootropics is a word, and I'm just already thinking now, just off the top of my head, that you could have a brain scan and I don't know if you found that this is why in the nootropic forums people go, I took something and I didn't feel anything, and someone else takes something and they go, wow, what a massive effect I got. And and you're using your system the QEEG system is going, well, maybe this is a way to quantify what brain supplements work best for certain individuals.
Anybody out there with a supplement company wants to contact me and develop some questionnaire and get some brain scans, I'm up for it, of course.
I think I can already put you in contact with some nootropic supplement company people.
Yeah. It's to me, they were talking about stuff that it's obvious. Yeah. You do question, if you have enough people with enough results, you get a physiologic, it's a physiologic test with parameters, and you just have to have an N that's high enough.
Yeah.
And, with using computers, it's just so much easier. I mean, before I would have to remember, I'm making myself obsolete, unfortunately. I had to remember what, Alzheimer's looks like. I have to remember what ADD, there's 6 different types of attention, that can manifest as attention deficit disorder on a QEEG. Maybe even more. Maybe, I'm sure there are, but, there's basic types. And so there's so many different subtypes and so many different waves and everything it takes decades to really start to be able to see the EEG where it speaks to you. And it takes a long time to be looking at those squiggles.
Yeah, it's a little bit like other imaging studies or ultrasound or other scans, and it takes a while to actually understand what is this picture actually saying to us right here.
Yeah. I mean, now I think I have mirror neurons for EEG. So when I see somebody's EEG and it's in distress, I feel bad. I mean, it's like, it's like seeing a friend and they're not, their voice is down, they don't look good. The EEG looks like that to me. It can be a sad song, it could be a happy song.
And what I love about when I was doing my research on it is that when you were talking earlier about that SMR and how you could actually train it. So what we're talking about here, because you're using the word training, and so you're actually using the device to train yourself, but that you'll actually get to a stage that you'll be able to feel that state. And so it's not, so this will be a question that would come up where people would say, well, how many times do I have to use it? Or do I have to keep using it for the rest of my life? Or would I have to use it every day to get a benefit out of using neurofeedback training? But of course, it's going to be a spectrum where you are and what condition and what you're trying to treat. But at the end of the day, I loved it that you're training yourself to end up feeling the state, and you'll be able to try get yourself into that place without actually needing a device on your head.
So is something that, most people who are healthy, say between 16 and 65, a pretty stable brain, and when they do neurofeedback, it should stay. At least 6 months, even a year, to where maybe they'll need boosters. But yeah, once you get that feeling state in your brain, you can feel it. If you know now, you can. When you have too much delta in your brain, you can feel when you have too much high beta. You actually, I encourage people to learn to feel their brains. I think we're not taught to, and you can.
Yeah, I guess one way people listening might feel is you sort of know when you're hyper, when you can feel that state when you're a little bit hyper. Or would you say even as like a state of brain fog, that when you just feel dozy and confused, or you're not completely with it?
Well, you might be in too much delta, like a dreamy delta or a theta couch potato, one of the two. But when you feel like that, I might even say that to people that know me. I feel like I've got too much theta in my brain. But yeah, you have days like that, and you can absolutely learn to mount different brain waves, or I call them positions. But you can put your brain into different electrical postures or positions at will once you learn how.
So would this alter your personality?
No. So you still think you still think you're you. I don't know. That's one of the things I have gone, and thought about that quite a bit. I can tell you a case that I remember where I started thinking about this. This was an older man. He was in his 50s. He still lived at home with his mother. He had no ability to socialize. Was so, had so much agoraphobia. He couldn't go to the bank and write a check in front of the teller because, he would start shaking and stuttering. Has never had a job. He did 50 sessions of neurofeedback. I think it was about 50 to 60. And I didn't see him for a while because, he went out to the clinicians, and, your patient goes and they do neurofeedback, and then you see him back for scans. So I didn't see him for a while, and he came back, and his hair was kind of like, slicked a little bit, and he had different clothes. He had a job. He had a girlfriend. He had an apartment. And I'm talking to him like to me, he looked like a completely different person. I said, "Do you think you're a different person?" And he paused and thought about it. And he said, No, I still think I'm me. So there's a constant observer in there. This is one of the conclusions I've come to in doing, umpteen thousand hours of this. There's a constant observer. There's an I, and that I doesn't change. That's the way you can know you changed, because there's a constant. So it depends on how we're defining personality. If you were on disability and now you're not on disability and now you're empowered, does that change your personality? I guess, but I don't think it changes your core personality that you develop when you're up to 3. No, I doubt it. You still like chocolate ice cream.
Yeah, I'm just thinking here when you were saying that where you take someone out of a dreamy state and more into maybe a more conscious state, like you tend to get people who would say they are just naturally dreamers, or quite arty compared to your high-powered exec. So that might be a natural personality for them, but there's also times when people can get stuck in the wrong state, right? So they can be stuck in a too intense state where they're hyper focused, or there's people who can't actually click out of the overly dreamy states. And using neurofeedback, they're able to get themselves more in control. That variability is that control factor.
Exactly. So the brain should be flexible and move through different states. No brainwave is bad, but a brainwave in excess, or a brainwave that is happening when it's not supposed to be happening, is causing abnormality. So the example you're giving me here, I can think of another patient who, had a terrible thing happen to them, and have been exceptionally fearful since very young. And they're a person who, that's now their belief that it is part of their personality. So I am a shy person. I am this. Maybe the person is a shy person because they have, right frontal beta or high beta, and that social area, that social attention processing area doesn't work properly. It doesn't relax. It's always in a threat response for whatever reason, by environment, by birth, by injury. And that's then they believe that's them, and that's not them. So in that case, maybe it helps people be more of who they are. Let me just add here, so with the quantitative EEG, we can quantify it, but then what does that mean? What it means is we're comparing it to a database of other brains. And in general, what we mean by other brains, we mean normal. And by normal, we mean a statistical term. People that fall within one standard deviation of a derived mean. Now, how did they get that? Well, they got that by following people for 2 years, and children, adults, all around the world. And what's been developed through that is the understanding that there is an optimal operating tolerance for the electrical organ we call the brain. You are not your brain. It is just an organ of self-regulation in your body. It should know how to control your heartbeat, how to deal with digestion, how to deal with your breathing rate, and how to move your hands, all of these things, the summation of the mega pattern that gives you your current state. So when we're talking about the brain not working properly or working inefficiently, it means it's not letting you be in a proper state in a proper place and time.
Mm-hmm. And do you think then a lot of adults end up in that state too, just from chronic stress? Does that?
It's funny. I live in a third world country. I have for almost 10 years now. I mean, it's a developing country. Actually, I don't even think it is, but that's what many people in what they would call the first world call it as. But so I'm just trying to relate. But the people I see, I have lived, and you see great disparity in wealth. And I find that the people that don't have the cell phones and don't have all the stuff and live around their family and live on land and everything like that, they don't have all this modern conveniences that cause all this stress. But anyway, in the modern world, this on-the-go thing that everybody seems to be doing, where they have continuous partial attention because one hand is on the phone, and one's driving or doing whatever, I think is really damaging for the brain. I think it's really causing the brain not to be able to see kind of a level self-regulatory pattern. So, with regards to stress, it's how the brain is dealing with stress and telling the body what to do. And this can kind of increase the ceiling there. That's how I see it, is by getting the brain to work in more of this optimal pattern that is, for the specific state, then there's more room to deal with being late or traffic or, bigger things.
It's that tolerance factor where I always imagine it like that, like a bucket, and that if you've already filled the bucket close to the brim, someone honks their car and that it spills over. You had no tolerance to accept that. And what you're talking about is that, if you're able to electrically vary it down, that you'll be able to go into a more busy environment, but it's not going to overstimulate you into a abnormal stress response where you overreact, maybe.
Exactly.
Yeah.
Exactly. And somebody might naturally say, many people have head injuries and don't know. I would go as far as to say that it's half of the population that I see who have failed a psychiatric med. So if somebody comes to see me for neurofeedback and they've already been to the psychiatrist and they've already been on 1 and 2 meds and they haven't worked, I'd say the population is probably 50-50 head injury. And they often don't remember because they bump their head. And part of that is remembering, right? You have amnesia. So they have to think about it. Oftentimes I'll insist. I've had people come back to me a year later. There's a man who runs a big company, CEO of a big company, and he had a brain scan. And I told him, this is clearly a head injury. It wasn't until a year later that he called me and he said, I remember, you're right. You were right. I said, I know I was right. So the point I'm making here is that if you bump your head, say, and it goes into a slow rhythm, then that area of the brain is now not going to be processing with the rest of the brain. It's not going to keep up with its neighbors. If that area happens to be an area that deals with stress, then it's not going to keep up with being able to deal with that stress. So the stress is going to be felt as higher, to the person, because the brain now is responding to a threat because it knows it's not working on all channels. So by balancing the brain there, you're able to, again, increase that ceiling.
And so I don't think we've touched on with neurofeedback training. What actually happens? Are you sending electricity into the brain, or is it auditory? Is it coming through sounds in the ears? Is it visual? Like, how are you actually getting a new stimulus to change the brainwave activity into the brain?
So in my field right now, there are sort of two emerging fields that are neuroregulation and neurofeedback, or neuromodulation and neurofeedback. When you refer to neuromodulation, you're actually putting energy into the head. So like a small voltage, you can use magnetic current or magnets or small low voltage electricity. I don't do that. I like the pure technique of neurofeedback, using the brain and the person to help themselves. So in neurofeedback, it's completely passive. All you do is put a cap on your head. Feedback can be in the form of, say, a video where it turns off and on in response to the brainwaves. If you're learning to pay attention, then when your brain goes out of attention, the movie plays. But it could be you're treating for depression. So when you feel sad, the movie stops playing. But this is happening on the order of, say, every 400 milliseconds. So the learning process is unconscious. It's not like you sit there and the movie plays and then it stops playing. You watch it and it goes off and on, off and on, off and on. And you don't at the beginning really understand what it's doing, why it's doing that, but your brain eventually learns and figures it out.
Yeah,
which is operant conditioning.
Yeah, so that's what I found fascinating. So you're using, in this case, a visual stimulus. So it's coming through your eyes, and it's just the image that you're watching is breaking, but your brain understands that's an abnormal response and that it needs to change its brainwave activity.
Well, it starts to notice that it works more efficiently when the movie is playing. Goes, oh, look, humans are, well, I think probably biological systems want to occupy the lowest word that we put on it. If I told you to get me a glass of water and you went and, did 3 circles, went out, climbed a ladder down the window, went around the house a couple times, times and went to the sink and then brought me water. And I said, why did you do that? You could have just walked through the door and get me the water. You would never do it the other way again. Once I showed you the proper, efficient, easy way. Same with the brain. Chiropractic, I think, is somewhat similar. It can teach the spine how to get into a more optimal pattern, one of the only other things I can find that really works directly on the central nervous system, by the way, like neurofeedback, it gets the brain into a more efficient, relaxed pattern. And it likes it. It's a better state for it. So once it goes there, it says, oh, I like this. And it goes more in that direction. So the clinician makes the computer make the brain work harder by setting a different threshold. So now the brain it was able to get the reward at, say, 10. And now it's, you set the number to 8. Now it has to get it lower. I'm referring to Z-scores.
Okay. So that's what would happen in the training program, is that you would actually change the point, how hard it is to get that reward. You would actually make it harder and harder, so the brain actually gets trying to get more efficient to get to that state.
Exactly. So you start kind of just below where it is. And we're training waves. Sometimes waves are up and sometimes they're down. So what we're doing is we're trying to catch it at the optimal pattern. So somebody's waves are too high. Somebody has too much high beta, right? So what happens is the waves are going up and down, and we set a line on the computer, to say, okay, when they go below 3.5 microvolts, trigger a reward. So then let's say the reward now is happening 50% of the time. The clinician can see, okay, 1 minute happened, they got 30 rewards. So now 3 minutes goes by and they got 40 rewards, 50 rewards, right? So the reward has climbed up and up. If we were to just leave it, theoretically, the brain would get it to a point of just playing continuously. But that's called watching TV, right? That's not brain training. It's actually probably the opposite. I think I'd call it programming. But the brain training is, so it has to be made more and more and more difficult each time the brain sort of learns the pattern that's being asked. Or again, it gets lazy and just stays where it's at.
And we're getting to like the world of neuroplasticity here, where you're actually getting the neurons to fire differently. And I'm wondering here if you get like different myelination. I don't know, neuronal growth with what you're doing there.
Well, I would say undoubtedly. Are you familiar with the in the meditation world, the study that Harvard did with fMRIs, 8 weeks from people that had never meditated before in their lives, and then they did meditation for 8 weeks, and they showed hippocampal volume increases.
Wow.
Increase in connectivity. This is, people are listening to this, they're going to Google it right now, Harvard meditation study.
Yeah.
But it's like, it comes up in the Harvard Gazette now. So we know that happens. Again, trauma, right? We see decreased hippocampal volume in people who have had trauma, right? So we know that things affect brain. We know that we can damage things and lose volume. And now it's been shown. Oh, the London taxi driver study is another one. Right. Right. There was a study by Monastra in the mid 2000s. So it was 2004, I think, 2005. But they looked at children with ADHD. They gave a group. It was 50 in both children meds, but they gave only one group neurofeedback. And I'm sorry if I'm butchering this. It's been over a decade. And the group that had the neurofeedback, after year 1, they took them both off meds, scanned both groups' brains, and they found actual differences trending towards normalization in the group that had the neurofeedback. I don't think it was fMRI though. I think it was QEEG, but it might have been MRI. After this, I'm gonna have to go look again.
Okay. Well, we're coming up to our time. I know I've got to let you go. But before we do that, I just want to find out. So I think we've got a good general overview of what neurofeedback training is, how it works. But if you would say then, like, some other conditions I can think of, if someone's thinking, should they try it? As you said, actually, most people should try just even get a brain scan, would be step number 1. And it is available in the US to be able to do that, you said. So is it? that you could, if someone's listening right now and they're in the US, how would they go about just having a general brain scan, that $100 scan?
Well, they can contact us at remote neurofeedback solutions.com.
And then you'll be able to connect them to a facility that would be able to do that.
Yes, and we also have the ability to send them a scanner and have it at home. It's not $100 to do it that way, but it's fairly reasonable.
All right.
It's right around $300. So it can be done if they're near one of our facilities, and we have facilities on both coasts in New York and Boston and California. And you had just kind of asked a question there, touched on it, and I wanted to say, yeah, I think that anyone out there who has been suffering for a long time with psychiatric, medical, or neuropsychiatric problems and has gone a traditional route and has not had relief, to me it makes no good sense why they wouldn't try this, because it is non-invasive and the risks are very low, and the potential benefit is relief, decrease in symptoms. So I haven't found great applications with schizophrenia. I haven't found but there are people that would disagree with me. Bipolar is another one, but a lot of people seem to be diagnosed with that, and they don't know why. So people with it should have scans because it could be manifesting from an injury, and in that case, it's very treatable. PTSD is a big application for it, and the average number of sessions is about 20 that people need. It depends on the condition. Some people are rapid responders. I have seen people respond in 5 sessions, 10. But generally 20 is the average. And then, people who maybe are older, have had conditions longer, severity, they can go up as high as 40. Conditions like autism, you're looking more in the higher numbers, like 80, but you still can get very good results with all the core symptoms of autism. Mm. So the different applications are varied, from peak performance to, Alzheimer's. And it just depends on the individual. And that's why I think that before anyone does any neurofeedback, they need a QEEG that's been done and read by a medical professional or by somebody that really is trained in being able to read EEG, not someone that has a mail order degree.
Mm-hmm. Yeah, and so this sort of feeds back again as society now with health wearables, and what I touched on earlier in the talk. That market's only growing. So in a sense, here you could use the baseline scan to say, like, what state is your brain in? Like, how hard do you need to work, and which direction should you focus your energy on more?
Correct. And so in some cases you can tell, there are scans that I can see and one that comes to mind is low alpha. It's not a great, you can increase it with neurofeedback, but it generally happens to do with the thalamocortical rhythms, and I conceive that as coming from somewhere kind of elsewhere in the body. So the brain is not getting enough power. Why not? And so, it might be a metabolic issue. And so in many cases, I'll see the scan and I'll say, go back and do XYZ, and then let's come back and get a scan in 3 months and see how your brain looks. And then maybe the picture will be different. But generalized low power, global low power, where you look at a brain, it's just blue, all over. It's hard to treat that. It's hard to bring that up in the brain. And so they might need some kind of better diet, keto diet, or some kind of supplementation before neurofeedback might be effective.
So I'm wondering, anyone who's going to do the scan now, it's a little bit like cholesterol testing, and that can be varied dramatically. I had Dave Feldman, a biohacker with cholesterol, and he showed what you ate 3 days before your test made a dramatic difference to the blood test. Would you say there's something that people should be aware of to get the best baseline test? Like, if you want them to do the best brain baseline test, is it in the morning? Is it in the evening? Do they need to abstain from something? So I don't know if you do already give those hints or guidance when you send a kit out, but is there anything you would recommend just so that someone actually gets the best scan to know what's actually going on?
Yeah. So don't drink alcohol, and benzodiazepines also can have fairly profound. a good QEEG, a person that's experienced and able to read the QEEG can read around just about most things and still get an idea. But you want to get somebody in their state of being. People often ask, does the food I have interfere? Does I'm anxious today, I'm nervous today. It's a statistical test. And so, the more QEEG somebody has, the more more valid the findings are. So the first one is just always, for me, it's not an absolute fortune. I didn't just tell the person's fortune. I just got the first scan, right? And I can start to make some inferences. Sometimes they're very, very clear, and sometimes they're not. But that being said, because of the statistics and the robustness of the database, individual variations kind of in how you feel that day or how nervous you are shouldn't have a profound effect on the QEEG overall.
Okay.
When you see something 3 standard deviations out, it usually doesn't go, by definition, doesn't go down to, say, 0, on the Z-score. It doesn't go straight back to the mean, right? If it's always out at 3, right? It's usually at 2 or 4, right? You understand what I'm saying with regards to how, the fluctuation of the waves.
Yeah.
And so when you see, so you don't want to overread them either. People will see a little tiny spot and they'll start, making all these judgments. So that does come with seeing a lot of scans. Dry hair. But if somebody takes meds every day, they shouldn't stop their meds for the QEEG. They should have them in the state they're in.
Okay. Well, that's good tips to know.
You want to, yeah.
Okay. How can people learn more about you or about neurofeedback? Do you have any links that you would direct people to?
Well, sure. As I had said, Remote Neurofeedback Solutions or internationalneurofeedback.com. That's our business to business. So if anybody is in a clinic or they want to bring this into their clinic and have us assist them with everything from getting the equipment to the logistics to scans, protocols, even running the systems for them remotely, that's something we do quite a bit.
Okay.
So that's how to reach me. I also do individual retreats in my home in Costa Rica, where you can learn to surf and do meditation with me, and all kinds of different treatments that we do there. And that's neurofeedbackvacations.com.
Yeah, so you've got a full spectrum of availability. Then is what it sounds like for people, from clinicians to general consumer like me.
Well, I dropped out of society in 2008, went surfing, and people started hunting me down from my old practice and doing retreats with me. And I wanted to surf, and I liked doing neurofeedback, so they started surfing with me doing neurofeedback. Then they went home, and they wanted to do neurofeedback at home. So I started sending them equipment. So I went from neurofeedback retreats to how do I get this in my practice? And so then I started running them in clinics, and now we have, I think something like we get about 1,000 scans a month.
Oh, cool. Well, I hope I can do one day. It sounds fascinating.
Let me know. Let us know.
Yeah,
contact us. We'd be happy to.
Yeah, no, I think it's important. I've always said, whenever I looked at a gym, so people are working out their body, but there's never a section for the mind. I always found that bamboozling, thinking, so you go work your body physically, but your mind, you need to allocate time or a space where you work your mind, and society doesn't seem to do that so well. So No, and it's often somewhat amusing to me. We use gel caps, so we use solution. I have dry caps as well, where we don't use solution. And some people will not. The is superior. The connection, the picture, the clarity. Having tried them all, but some people won't. Even if I tell them you need this, they don't want to mess up their hair. All right. Okay. So you say that our connections jumped a little bit at times. So you said the gel one is the best one to go with.
At this point in time, yes.
Okay, cool.
Yes.
All right. Well, Freddy, thank you so much for coming on today and educating us. I mean, I could get you on and I'm sure there's so many more other topics around this we can talk about, but I'll let you go. But again, thank you so much for teaching us about neurofeedback training today.
Well, it's been my pleasure to just even get the message out there that it is available and it really does work.